I'm Dr. Kat, a board-certified plastic surgeon, and I am honored that you chose me to be your plastic surgeon. As my patient, you have a responsibility to follow your pre- and post-operative instructions in order to ensure the best possible results. Plastic surgery is not a destination. It is a journey, and along this journey, there are steps that you must follow in order to ensure that it is exciting, enjoyable, safe, and an overall wonderful experience. So please watch this video carefully as I review your instructions. Now, myself and my medical assistant, Veronica, will review the pre- and post-operative instructions for your surgery.
Hi, I'm Veronica, Dr. Kat's medical assistant. I'm so excited for your upcoming surgery and to be a part of this journey along with you and Dr. Kat. I'm here to give you all the information and instructions you need in order to have a successful outcome.
So, Veronica, how do you think we can make people remember the instructions and follow them? Should we just send them the video like over and over again?
I just wish I could follow them around and make sure they follow all the instructions.
Well, I know that sometimes you just try to scare them and tell them this could happen, like your skin's gonna die.
I know, my scare tactics are kind of rough,
but I think
though.
then they have like nightmares. Like I've had patients tell me, oh my God, Veronica told me if I don't listen, then...
I'm just trying to warn them because I told them if they don't follow instructions, Dr. Kat will be upset.
Oh yeah, no wonder they come and they're like, don't be mad at me, but I accidentally blah, blah, blah.
I know, they have like this fear. No, but it's really important. That's why I do that.
No, it is important, and I think a lot of doctors don't emphasize proper post-op instructions, and then they have some outcome, something happens, and then it's too late. So in the end, I just want everyone to be able to follow instructions and have a good result, not mess up anything that I've worked so hard to do.
Exactly, I agree. As long as they follow their instructions, nothing should go wrong.
Maybe if we make the video more funny, then they'll remember it better.
I feel like we're pretty funny, right? People think we're funny.
Sometimes I'm funny. I don't know. Most of the time I'm pretty serious. Okay, so let's start with 2 months before surgery. Okay, so 2 months before surgery, Veronica, what's the most important thing?
To stop smoking.
Yes, and this includes, first of all nicotine products, so gum, electronic, anything with nicotine in it, and then also the other inhalants that they also ask about.
Don't smoke pot, yes, that counts. Nicotine gum, things like that. Hookah, don't go out to the bar, just please.
But yes, also this includes any inhalants because obviously while you're under anesthesia, you'll be on the anesthesia machine. So anything that affects your lungs will affect the way that you recover from surgery and also minimize complications. So please, no inhalants, no smoking, no nicotine of any kind. And nicotine can interfere with the blood flow to the skin, and that affects wound healing. So potentially your skin could die, fall off, your wound's not gonna close. So please, it is very important.
The last thing that you want is to have this beautiful fat grafting to your booty and then it's gone because you smoke.
I will literally cancel your surgery if you do not follow the nicotine instructions. So please do not smoke anything.
I've seen it happen.
Okay, so then also around this time, you're gonna need to have help after surgery. I know that some of you feel really heroic and you're super tough, but really you need to have some help. So call your friends, family, anyone after surgery that you think.
Anyone that will help you.
And also, you cannot drive after having anesthesia. You cannot throw yourself in a cab. You need to have a responsible adult for the first 24 hours.
Yeah, and Uber doesn't count either because you're gonna be by yourself. We need somebody who can drive you home, get you settled, make sure you take your medications so that you'll be recovering in peace.
And also, if you are having a more extensive surgery, you may need to stay in one of our plastic surgery aftercare facilities, so they will be able to help you. And if you want to stay for more days, just let us know. We'll help you arrange that.
I know, I want to stay there. Can I just go and stay there for a little? I have them pamper me, take me to the bathroom, give me my medication.
They'll wash your hair.
They do everything for you.
They'll do your drains.
You need to go there.
They'll get stuff for you. Now, 2 weeks before surgery, so this is where it really becomes important. You really need to pay attention. It is so important to stop all aspirin, Motrin, ibuprofen, Aleve, vitamins and herbals, alcohol, 2 weeks before and after surgery. Even my daughter knows this. She repeats it a ton of times because I say it so much.
Just cleanse yourself. Take the opportunity to make sure that your body is nice and clean for any additional substances, and do not take Advil. She will cancel your surgery because of Advil too. Yeah, no, even if you have a headache, take Tylenol. Don't take Advil.
Yes.
If you have cramps, take Tylenol, not Advil.
And if you have any questions about something, please ask. But in the end, you're just gonna be able to take Tylenol, and pretty much you're gonna have to stop everything else because all those other things could potentially make you bleed in surgery. And as you know, I hate any blood in my surgical field, and I want you to have a really, really great, easy recovery.
2 weeks before surgery, please do not overexpose yourself to the sun or get a sunburn.
Yeah, you really do not want to have your skin peeling off in my surgery site. Please do not do that.
Save the bikini body for after the surgery.
Yes, then you can safely tan with sun protection, of course.
And you can show everyone how you look.
The week before surgery, please let us know if you have a cough, a fever, any illness, or if you have any sort of skin changes or infections. If you are feeling sick or have a cough, please do not take over-the-counter medication without asking us. You also want to start thinking about what you'll need going into surgery. Most importantly, pick up your medications. Don't wait till last minute.
I don't want to be running to the pharmacy during your surgery because the nurse tells me, oh, she doesn't have this, or oh, she doesn't have that. So please prepare ahead of time.
And when you go to the pharmacy, you can also pick up the special soap that we recommend, the Hibiclens. You should be able to find it in almost all pharmacies in the cleansing aisle with the alcohol and peroxide. It's a green bottle. It's really easy to find. And also the TED hose. So we recommend using TED hose that is above the knee because when you're recovering from surgery, you don't want to be constantly pulling them up. They have thigh-high ones, and they don't have to be overly tight.
No. Please don't get them too tight because then we can't get them off of you.
Yeah, so less than 20 millimeters of mercury, anything that feels comfortable because you're going to have to be in the TED hose for at least a week after your surgery. It helps with your circulation and prevents you from getting a blood clot.
So 2 days before surgery, we want you to cleanse your body with the soap that we told you about. And
The
just make
Hibiclens.
sure you wash it really good, keep it on for like 2 minutes, scrub in all the creases, in between the breasts, underneath.
And the belly button. The belly button.
Yes.
We have found all kinds of things in the belly button.
Get a little
I will
Q-tip.
personally clean it in your surgery. However, please, if you can remove bacteria, all kinds of lint, debris from your belly button before surgery, that will help keep it clean, minimize any chance of infection.
And your back as well. Make sure you scrub your back because you don't want to be on the operating table and they're cleaning you and they notice like they didn't clean their back.
Also, shave. Please remove all hair from areas around your surgery site 2 days before so you don't have any open cuts or wounds. So shave and start using the Hibiclens washes 2 days before surgery.
We don't want Dr. Kat to have to search through a national forest to find her incision site.
Yes, and we'll just end up, the nurses will end up shaving you on your operating room table, and it's just gonna, you're gonna pay for that extra OR time, so just don't do that. Shave before.
So 2 days before surgery, also please try to stick with a light diet. So even though you're not gonna be able to eat after midnight the day before your surgery, don't go like to the nearest In-N-Out and get a burger and fries.
Yeah, don't go to Disneyland and pig out because I actually had a patient who did that.
Yeah.
And when I did, because you don't want to be bloated during your surgery, some of the pain medication may also make you constipated, and you just don't want to be full of food and constipated after your surgery. You'll be miserable.
Trust me, it's not an issue that you want to have. You want to be able to focus on recovering and not be worried about your bowel movements.
Yeah, so eat light the day or two before surgery. Okay, so the night before surgery,
Oh, we're getting closer to your transformation.
please do not eat or drink anything after midnight, and this includes drinking water. Now, you can take your medication if you have high blood pressure pills with a small sip of water the morning of surgery, but otherwise, please do not eat or drink anything the night before surgery.
That also includes mints, gum, anything that you put in your mouth. Please, just midnight, nothing.
Also, please do not put lotions, deodorants, creams, or anything like that on your skin. I'm going to be marking you just before we go into surgery, and so that will keep me from being able to mark you appropriately.
And also, you don't want to wear any valuable jewelry or contacts to the surgery center
we
the morning of
trust
surgery.
our nurses, but hey, if it's like something,
Can't be responsible.
Not us.
You be responsible.
And also just wear loose, comfortable clothing. I mean, please do not wear super tight leggings or pants, just something that you can get in and out of easily. So now we'll review instructions specific to breast augmentation with implants. How come I got the saline one?
I don't know.
Well, that one definitely feels a lot better. Okay, so first we'll start with medication instructions. You will receive 4 medications. One is an antibiotic, Keflex.
Prevent infection.
And it's very important that you start taking this as soon as you can after surgery. And I tell people the easiest way to remember, because this medication is 4 times a day, to take one with each meal and then an extra one before bed. The second medication is a prescription pain medication, which is called Norco. And this is a combination of Tylenol and something to help you relax. And honestly, you should be off prescription pain medication within a day. So you take this 1 every 4 hours or 2 every 6 hours.
Yeah, just as needed. The sooner you can switch to Tylenol, the better, because remember, we talked about that constipation thing? Well, the pain medication makes it a lot worse.
Yes, and the third medication is something called Zofran, which is an anti-nausea medication. And usually I like to tell people to take it about 15 minutes, wait, and then take the other medications, because that way you have a little bit of anti-nausea medication in your system, and it'll prevent you from getting nauseous from the medications. And also, you don't want to take any medication on an empty stomach.
Yep, exactly. The last medication is Singulair.
So Singulair is an allergy medication. It's used off-label for breast implants, and in many patients, it's believed to prevent the formation of capsular contracture, which is the hard scar tissue that can form around your implant. And I do everything in my surgeries to prevent scar tissue formation. So Singulair, start it 2 weeks before your surgery and just keep taking it. Really, there's very minimal side effects.
Yeah,
I think
might as well protect yourself.
And I think some people, maybe they feel a little bit sleepy, so we say take it in the evening. And I actually wrote the research paper that shows that Singulair helps prevent capsular contracture. Did you know that, Veronica?
I didn't. That's amazing.
Oh yeah, it's on all your consent forms, and I wrote that I think in 2009. The only other medication you start before your surgery is Arnica, which we have at the office, and this reduces bruising and swelling. And finish the whole bottle. You take it for a week, but you start it 2 days before your surgery.
Yep, and take it twice a day. When you wake up from your breast augmentation surgery, you're going to have these awesome implants, and you're going to wake up in a surgical bra. We want you to keep that bra on for a good 6 to 8 weeks.
Yes, please do not wear sports bras, real bras. I mean, anything like that is just going to put pressure on your implant in a way that I don't want you to. And if you come in wearing some super cute lace tight bra in your post-op surgical visit, I will probably cut it off. I've had one patient get stuck in her bra before.
Oh my gosh. Yeah, no, the underwire, it can ruin the incision, it can just move the implant. It's really, really important that you stay in the correct garment for the proper amount of time.
And the most important thing is, please, for the first 2 weeks after your breast surgery, keep your arms by your side. You should feel your arms touching. So this is okay, but no reaching, because your pec muscle is my surgery site. And where does the pec muscle attach onto?
Oh my gosh, the implant.
And onto your arm. So if you raise your arms, one, you could stir up bleeding around your implant, and secondly, you could displace the pocket.
T-Rex, okay, for like 8 weeks. T-Rex arm.
Like no housework. Use it as an excuse. Like, oh, honey, I can't do housework. I can't,
wash the dishes.
Exactly. Have someone wash your hair if you need to. But please, just keep your arms by your side the first 2 weeks after surgery. So driving, because obviously you have to use your arms, you can usually drive about a week after surgery if you're not taking prescription pain medication.
Yeah, please do not take your medication and then go out driving and, God forbid, fall asleep or something like that. We just want you to be extra careful.
Or if you have a very hard to use vehicle where you feel like you're using your arm, you definitely want to give yourself a little bit more time to recover. Okay, so showering. Everyone wonders, when can you shower? You can shower 2 days after your surgery. The tapes may get wet, just blot them or pat them dry. If they're really wet, you can blow dry them. What to expect? Everyone always wonders, because there's a lot of swelling after breast surgery. So just know you're going to be swollen. Your chest will feel tight. That's normal.
Yeah, no, especially if the implant is going under the muscle has to stretch out for that implant.
You'll literally feel like you did 50 push-ups. And so what I tell people is, for the swelling, you can sleep sitting up, just prop a few pillows underneath. You also don't want to happen to roll on your side. And please, sleep sitting up for at least 2 weeks after your surgery. And then you can also ice.
Yeah, just give a little bit of ice.
Yeah, so ice on top, ice on the side, and that will help reduce the swelling as you recover. Now, everyone always gets alarmed because sometimes one breast may swell a little bit more, or the swelling may come down on one side. That's totally normal. If you happen to use your arm more on one side, it's going to swell.
If you're right-handed, your right side might swell a little more.
Please do not carry anything heavy.
Oh my gosh.
Yes.
The one patient that walked in with her heavy purse the day after her surgery.
Have someone else carry your purse for you if it's really heavy, or just empty it. Make sure it's light. In terms of exercise, because everyone always asks about exercise. So immediately after your surgery, we do want you to walk with any surgery. Get up, walk around, nothing strenuous.
to the bathroom, around the house, to the kitchen.
And for the first 2 weeks, just light walking. You can do like uphill walking 2 weeks after that.
Yeah, but in general, the rule of thumb is 6 weeks until you can go back to your normal exercise routine. And even then, with breast augmentation surgery, we just want to make sure you're not developing your pec muscles so that they press down on your implants. So avoid any chest exercises as well.
Yeah, there's really no reason to do chest, honestly, especially after implants. And so just 6 weeks is the key time for pretty much everything. In 6 weeks, you're pretty much healed. So, you know, a lot of times we get called like, hey, can I do this exercise? Can I do Pilates? Can I do yoga? Can I do whatever it is? Just please wait 6 weeks after your surgery.
What do we say for every phone call?
It's pretty much 6 weeks.
6 weeks.
The other thing is, it is normal to also feel a little bit numb on the side of your breast and also on the nipple. It usually comes back 4 to 6 weeks. It's just because the nerve gets stretched. It's nothing permanent.
Just give yourself time. You know, it takes time to heal.
And it takes time for your implants to drop in its proper place and for the swelling to come down, and sometimes one side comes down more than the other. The things to look out for if something bad is happening is pretty obvious. Yeah. Like literally if one side just blows up, feels super painful and turns purple or red, or you have like a lot of drainage. I mean, none of those things have ever happened, but
I've never seen anything like that,
But if something like that happens, or if you have a super high fever after your surgery, those are the reasons to call and let us know immediately. All of your sutures are dissolvable, and at 2 or 3 weeks, you will start scar therapy. It takes about 2 years for scars to completely fade. Now, for breast implants, there are long-term instructions. So the first one is that at around 2 weeks, we will have you start breast massage, and it doesn't have to be complicated. Literally, you just press in, hold for 10 seconds, press up, hold for 10 seconds, press down, hold for 10 seconds. There's no particular number you have to do it, certain times of day. I mean, honestly, your pec muscles are constantly massaging your implants, so you don't need to be too
aggressive.
Yeah, or too uptight about it. It'll be fine no matter what. And then if you have any deep dental work, not cleaning, but if you have deep dental work, if you start to have a urinary tract infection or any sort of infection where there may be bacteria in your bloodstream, you do want to start antibiotics soon. Don't wait until the infection gets out of hand. And then you want to avoid any diet pills that have phentermine in it, like the fen or anything like that. Those can cause capsular contracture. And then for the Singulair, just stay on it. If you need refills, you can call Veronica. She can help you refill it. Or you can ask your primary care doctor. And then just relax and enjoy the process. Your anesthesia experience should be amazing. Like, you'll feel like you took the best nap of your life.
I know. I'm always jealous of the patients that they get to take like an 8-hour nap uninterrupted and then wake up looking amazing.
Think positive thoughts and support yourself with positive people.